Full Contact Podcast, buckle up, you heard. Like, follow, and share. Lycoming Ya Heard, we dare. Pulses of the Portland, why do people leave? Crank up the truth with Beth and Steve.
Welcome back to Lycoming Ya Heard. I'm Steve Marshall.
And I'm Beth Fulmer.
Today we're tackling something that's really hitting close to home, especially for those of you listening in Lycoming County and North Central PA. We're talking about mental health, a topic that seems to keep coming up again and again in our region.
Yeah, it really does.
And concerning situation that demands our attention right now.
Absolutely.
We've seen how important this issue is, through some of our previous deep dives on Lycoming Prison. The problems with judges and even the county budget,
Yeah.
It always seems to circle back to the need for better mental health support in our area.
It's true. We've seen how these different systems are really intertwined and how the lack of mental health resources kind of ripples outward.
Exactly. And this time the alarm bells are ringing even louder. FAFO Media brought a Facebook post to our attention.
Oh, wow.
An action alert from Marie Onukiewicz, the executive director of NAMI Northeast Region, Pennsylvania, NAMI NEPA for short.
Okay.
And she's warning about proposed cuts to Medicaid funding that could seriously impact mental health care access, and the vote is happening fast, Tuesday, February 25th.
Wow, that's really concerning and coming up quickly.
Yeah, so this is incredibly worrisome because Medicaid is like the primary source of health care coverage for a lot of Pennsylvanians struggling with mental health challenges.
Right, and Onukiewicz states that 3.1 million people in the state depend on Medicaid for their care.
Wow.
With 200,000 of those individuals right here in NEPA.
It's mind-boggling how many people could be effective. I remember our deep dive on Lycoming Prison, where we discussed that high number of inmates with mental health issues. Cutting Medicaid could make that situation even worse, don't you think?
Absolutely. If people lose access to these vital services, it's not hard to imagine more folks ending up in similar situations. We also talk about the strain on law enforcement when they have to respond to incidents involving individuals in crisis. Without adequate mental health support, those interactions could become even more frequent and potentially volatile.
Yeah, it's a domino effect that ripples through our entire community, and to really bring home the human impact of these proposed cuts, Onukiewicz includes some powerful stories in her post.
Okay.
She shares the experience of Katie Spencer, who credits Medicaid with providing her access to the care she needed to recover and build a successful life.
That's a great example of how important these programs can be for people. Katie's story really demonstrates the tangible benefits of Medicaid. It shows that access to mental health services can truly empower individuals to thrive.
Right. It's not just about abstract numbers. It's about real people's lives.
Absolutely.
Onukiewicz also gets deeply personal by sharing her own family's story. She reveals how her brother struggled with mental illness and relied heavily on Medicaid. The consequences were devastating when he lost that support.
That's heartbreaking, and it really underscores the urgency of this situation. It's not just about statistics or budgets. It's about real people in our community facing potentially life-altering consequences.
So what exactly is being proposed here? Onukiewicz keeps mentioning a budget resolution. What does that even mean, and how would it impact Medicaid?
Well, a budget resolution is basically a plan that outlines how the government will spend its money.
Okay.
This specific resolution being voted on proposes significant cuts to Medicaid funding.
Oh, wow.
To finance tax cuts.
So essentially, they're taking money away from health care to give tax breaks.
Yeah, that's the gist of it.
It's just hard to wrap my head around that. And this vote is just days away. What can we do? Is there time to make a difference?
It might feel like a tight deadline, but absolutely we can still make a difference. Onukiewicz is urging residents, especially those in Congressman Bresnahan's district, to contact him immediately and voice their opposition to these cuts.
That's our Congressman Dan Muzzer, right? For folks in Lycoming County, he's the one to call.
That's right. His number is 202-225-5546. His website's a good resource, too. You can find it at bresnahan.house.gov.
Okay, so even if we're not, experts on budgets or healthcare policy, just a phone call or an email can really make an impact.
More than you might think, legislators pay attention to the volume of calls they receive on specific issues. It shows them what their constituents care about.
Okay, that's good to know. So we've got Congressman Muser's contact information, and I know you mentioned the AMI website before. Is there anything else folks can do?
Absolutely. Even if you're not in Congressman Muser's district, contacting your local lawmakers is crucial. Here in Lycoming County, we're talking about Representative Jamie L. Flick for District 83, Representative Joe Ham for District 84, and Senator Jean Yaw for District 23. Let them know that protecting Medicaid and mental health funding is a priority for you.
It's about making our voices heard on a local level, right? Showing him that this isn't just some far-off issue. It's something that directly impacts our community.
Exactly. We've seen firsthand how the lack of mental health support plays out in Lycoming County. Remember our deep dive on those judges facing misconduct allegations? Some of those cases involve concerns about their mental well-being.
Oh, wow, you're right. And there were definitely questions about whether they had access to the resources they needed. This potential cut to Medicaid funding could make it even harder for people in positions of authority to seek help.
And think about the county budget. We've talked about how strained it already is. If more people are struggling without access to mental health care, it's going to put even more pressure on emergency services, the justice system, and social support programs. It's a chain reaction.
It's starting to feel like a bit of a mystery here. If these cuts have such potentially devastating consequences, why are they even being proposed? Who benefits from this?
That's a great question, and it's one that deserves further investigation. I think FAFO Media is doing really important work by bringing this issue to light. Their reporting empowers us to ask these tough questions and hold our elected officials accountable.
They definitely are. Remember, this deep dive was sparked by Mustin Hill's reporting on that Facebook post. Local journalism like this is crucial, especially in a situation like this where quick action is needed.
Couldn't agree more. Supporting local journalism means supporting a more informed and engaged community, and that's essential if we want to advocate for positive change.
So we've got a lot to think about here. These potential cuts to Medicaid could have a ripple effect on so many aspects of life in Lycoming County, but the good news is we can do something about it.
Exactly. It might seem daunting, but our collective voices can make a difference. We need to reach out to our lawmakers, share our concerns, and demand that they prioritize the health and well-being of our community.
Yeah, it all comes back to what we've been talking about. Mental health is just as important as physical health, and access to care shouldn't be a privilege. It should be a right.
I couldn't agree more. And this situation really underscores how interconnected everything is. We started with a Facebook post, but it's led us back to the prison system, the courts, law enforcement, the county budget. It's all intertwined.
It's like that saying, no man is an island. What impacts one part of our community? It affects us all.
Exactly. And that brings us back to the question we posed earlier. What does this proposed cut to Medicaid reveal about our leaders' priorities? Are they truly committed to the well-being of all members of our community?
It's a tough question, but one we need to ask. And honestly, it makes me think about our own responsibility as citizens. Do we just sit back and watch this happen, or do we stand up and fight for what we believe in?
We've seen throughout history that change happens when people come together and demand it. The power of collective action is undeniable.
That's what I find so inspiring about Unikiewicz's message. She's not just sounding the alarm, she's giving us a clear path to action. Contact your lawmakers, share your concerns, and spread the word.
And remember, you don't have to be an expert to make a difference. Your personal story, your voice, your concern for your community, that's what matters.
This deep dive has been a real eye-opener for me, and I hope it has been for our listeners as well. If you're feeling fired up about this issue, remember that FAFO Media is doing incredible work to keep us informed.
They are. Supporting local journalism is one of the best ways to ensure that we have access to the information we need to be engaged citizens.
So true. Big thanks to Mustin Hale for his reporting on this story, and to FAFO Media for all they do to keep us informed and empowered. And to our listeners, we leave you with this. What will you do to protect mental health resources in Lycoming County and North Central PA?
Your voice matters. Your actions matter. Let's work together to create a community. Everyone has the opportunity to thrive.
Thanks for joining us on this critical deep dive. Until next time, stay curious, stay engaged, and keep fighting for what's right.
The shore has no snooky, that's the word. And Missy Lane's sugar cookies slap, you heard. Like, follow, and share. Lycoming Ya Heard, we dare. Pulses up the port, and why do people leave? Crank up the truth with Beth and Steve.